changes to patient care as they struggle to overcome multi-million-pound debts.
Some services, as the Alexandra Hospital in Redditch, will be downgraded as emergency healthcare is centralised in Worcester. And Herefordshire's Wye Valley Trust says its finances are so bad it can no longer survive on its own. We'll have more on that later.
In Worcestershire, health bosses in the county have to save £50 million by 2015. The Accident and Emergency Department in Redditch will be downgraded, and the most complex children's and maternity cases will move to Worcester Royal. Joanne Riddle reports.
A bitter blow for Redditch. The Alexandra Hospital looks set to no longer deal with the most serious emergencies, complex births and extremely ill children. Instead, it's likely those patients will be sent 20 miles away to the Worcestershire Royal Hospital, where the A&E department would be enhanced.
If it's an emergency, you might be dead before you get there.
We need this hospital, and we need every service in it.
I just can't see why anyone could consider downgrading this hospital. It's absolutely superb.
On the table too, the possibility of another NHS trust running services. The Thames MP wants to consider the possibility of a Birmingham trust taking over the Alex.
I've had a Westminster Hall debate where the Minister has assured me that this hospital belongs to the people, it belongs to the NHS, and I think the people really deserve a choice as to who runs their services.
There's a shortage of experienced doctors in key areas like A&E and for women and children.
Realistically, it would take 15 years to train up those consultants that you need to provide a service, and we're looking at how we best provide a service over the next 5 to 10 years.
Last year, people rallied against plans to cut services, and 53,000 signed a petition. The Save the Alex campaign was in full voice again today.
The Acute Trust have made it clear today that if they were the provider, you'd have to travel to Worcester if it couldn't be dealt with here. There would be a 25% cut in emergency services at the A&E. I want to see what Birmingham can provide before we get into a mess about what Worcester can do.
This Droitwich MP chairs a group representing clinicians.
We're looking at the whole Worcestershire health economy, and I accept the importance of the Alex to the Redditch population, but our remit has been very much about looking at the quality and safety of the service delivered to the whole population of Worcestershire.
It's the most seriously ill patients who are affected by these changes. Health leaders are now working with West Midlands Ambulance Service to ensure there's enough cover to transport them away from here.
Health chiefs say 75% of A&E cases will still be dealt with at the Alex, but the row over that and who will run services goes on. Joanne Riddle, BBC Midlands Today, Worcestershire.
We're joining us now from Worcester Royal Hospital as the Chief Executive of the Worcestershire Acute Hospitals Trust, Penny Venables.